Assalamu alaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. As you know that we are discussing the developmental disturbance which affects teeth. So, our oral region. Today, we are going to discuss developmental disturbances of in the developmental disturbances of oral region. We are going to discuss the disturbances in shape. Now, the disturbances in shape involve 10 subheadings: dilaceration, taurodontism, dense invaginatus, supernumerary cusp, supernumerary roots, gemination, fusion, concretion, hypercementosis, and cervical enamel projection. Now, the first topic we are going to start is dilaceration. Dilaceration is a sharp bend or angulation involving the root of tooth. As you can see, the root of the tooth is slightly angulated at an angle. It's not straight. Although occasional examples of dilaceration result from trauma during tooth development, most cases are the result of continued root formation during a curved or tortuous path of eruption. In some instances, the cause of the bent or curved root is idiopathic. Dilaceration can complicate tooth extraction, therefore, it is very important to always take a preoperative radiograph before extracting the tooth. The next topic is taurodontism. Taurodontism is also known as bulk-like teeth. It is usually a molar with an elongated crown and apically placed furcation of the roots, resulting in an enlarged rectangular coronal pulpal chamber. It is a developmental disturbance that primarily affects molars, although premolars are also occasionally affected. Both the permanent and deciduous teeth may be affected, although involvement of the permanent teeth appears to be more common. This condition is readily recognized in the radiograph, characterized by teeth that exhibit an overall rectangular shape, as you can see in the picture, minimal constriction of the cervical margin, and there's no cervical margin defined, and an apically displaced furcation that results in extremely large pulpal jamble and short pulpal canals. The unusual root shape probably results from late invagination of Hartwig's root sheath during the development of the tooth, the mechanism that determines the shape of the tooth roots. Taurodontism may also occur in patients with amelogenesis imperfecta, Klinefelter syndrome, and Down syndrome. Taurodontism requires no treatment, but it can be a complicated factor during the root canal treatment procedures. The root canal is very difficult to perform in these teeth. Now, the next topic is dense invaginatus, which is also known as dense in death or teeth in teeth. It is a developmental dental anomaly which is characterized by a deep enamel lined pit that extends for far-varying depths into the underlying dentine, often displacing the pulp chamber and sometimes altering or expanding the shape of the root. Basically, there are two teeth. The teeth is present in the tooth. It primarily affects the permanent maxillary lateral incisors. However, maxillary central incisor and other teeth can also be occasionally affected. Here you can see how the tooth looks here. There it looks like there is a teeth in a tooth. These are the types of dense invaginatus. So, a mild form of this anomaly is relatively common, and it is characterized by the presence of an invaginated lingual pit that extends far for varying distances into the substance of the tooth. The pit is formed lingually in the tooth. That's a pit, you can see there's a pit, a slight pit is formed lingually in the tooth, and it can extend far, and it gives the shape that there's a tooth in a tooth. The extent of the invagination is not always clinically visible. The external pit on the lingual surface is often visible on clinical examination. Is never visible on clinical examination. It can be visible in a periapical radiograph. In most cases of dense invaginatus, the pit on the enamel surface uh, is located on the lingual aspect of the incisor tooth. However, there are cases that involve peg-shaped lateral incisors. They usually exhibit the pit at the tip of the conical crown. Peg-shaped lateral incisors are the incisors in which, due to the developmental disturbance in eruption, their shape is not like normal incisors. They are pointed. The crowns are pointed. So, in peg-shaped lateral incisor, there is a pit at the tip of the conical crown. A radiograph is helpful in establishing the diagnosis. Now, in the most extreme form of the dense invaginatus, the deep invagination results in bulbous expansion of the affected root. When the tooth is invaginated, the invagination actually results in the bulbous expansion of the root, and it is termed as dilated odontoma, although it is not a dilated odontoma, but it is erroneously termed as dilated odontoma. The base of the pit or deep invagination is composed of thin, often defective layer of enamel and dentine that is extremely vulnerable to carious destruction soon after the tooth erupts into the oral cavity. As a result, most teeth with deep invagination quickly develop pulpitis, pulpal necrosis, and inflammatory periapical disease. A tooth will clinically appear to be normal, intact tooth, but there will be an inflammatory periapical disease. Because of their altered structure, these teeth are seldom reliable candidates for successful endodontic treatment. Early radiographic diagnosis and prophylactic restorative treatment are essential if you want to prevent pulpal and periapical disease. Treatment of the more severe forms of invaginatus usually result in extraction. Now, there are basically the types of and the severity of invaginatus. In type 1, the invagination is confined within the crown of tooth, this just crown, and it does not extend beyond the level of cemento-enamel junction. Then in type 2, it extends apically beyond the cemento-enamel junction but remains within the tooth with no communication with the periodontal structures or periodontal ligament space. In type 3A, the invagination extends through the root, through the root, and it communicates laterally with the periodontal ligament space. And in type 3B, the invagination extends through the root, communicates with the periodontal ligament space, and also involves the apical foramen. This really results in the inflammatory periapical disease and the large root. So this is how it is in the radiographs. You can see the apical third, middle third, coronal third of type A, then apical third, middle third, and coronal third of type B2, then apical, coronal, middle third of type 3A and type 3B respectively. The blue sign shows the invaginations. That's all for today. We'll discuss the remaining disturbances in the shape of the tooth in our next class. Thank you. Jazakumullah khairan kaseera.